Medical outreach program. Thanks for staying tuned. The federal government has flagged off a national integrated medical outreach program in the FCT. Vice President Professor Yemi Osinbajo at the occasion says the program is aimed at sustaining the country's strategy on immunization that has led to appreciable achievements and to further improve primary healthcare services in the country. State House correspondent Jide Onifade reports.
As Vice President Yemi Osinbajo flags off the program on behalf of the president, says Nigeria and indeed Africa is on the verge of being declared polio-free, and this is expected few months from now as a result of effective implementation of the national immunization program, but agrees with medical experts that despite the efforts so far, there is a significant gap in bringing public health services to vulnerable populations, especially in the rural areas in the country.
The federal government is fully responsible for providing the required immunization, vaccines, in collaboration with our global partners to ensure consistent and sustainable availability of life-saving vaccines for all eligible children in Nigeria. We would ensure in the next couple of months that rotavirus and human papilloma virus vaccines are introduced into the national immunization schedule to prevent childhood diarrheal diseases and to reduce the incidence of cervical cancer in women. It is the firm commitment of the federal government of Nigeria that no child or individual should be without access to life-saving vaccines and primary health care services.
Medical experts in the country are of the view that child immunization has increased and reduced the number of child mortality. They, however, explained that there are indicators that significant number of children still die before the age of 5, hence the need for governments at all levels to increase the implementation of immunization program and ensure that every child is immunized.
The program's objectives are, amongst others, to reach underserved populations with basic medical and surgical services, to curtail the paralysis of circulating vaccine-derived poliovirus infections.
While we continue to make progress towards strengthening the health system, opportunities like the Integrated Medical Outreach Program provide unique platforms for the health system to bridge the gaps and make sure no one is left behind in the journey towards universal health coverage.
My advice to you is to ensure that just as the plan is good, your resolve to implement the program should also be upright.
The apparent good performance of the Federal Capital Territory is in most indices is still below the minimum acceptable targets, and we have to do more.
Here in Buhari, the conduct of the first round of the Integrated Medical Outreach Program has been flagged off for the unreached, underserved and vulnerable communities in 409 selected local government areas in the 36 states and the Federal Capital Territory. In Abuja, Jide Onifade, NT News.